What would you do if a stroke hit you right now and you were completely alone? If you're over 60, this scenario might keep you up at night. But here's what most people don't know. There are simple, powerful actions you can take immediately, even when nobody's around, that could save your life. This video is specifically for the 60-plus generation who might face this terrifying situation alone. I'm going to share 5 critical, life-saving strategies that every senior needs to know. No complicated medical jargon, just clear, actionable advice that could mean the difference between life and death. Stay with me, because what you're about to learn might literally save your life. And trust me, it's easier to remember than you think. Strategy 1. Recognize the warning signs and act without hesitation. When it comes to surviving a stroke, the single most important factor is recognizing the warning signs and acting immediately. Here's the brutal truth. Every second counts because your brain tissue is dying without proper blood flow. Too many seniors make a fatal mistake. They dismiss early symptoms as just getting older or having indigestion. That hesitation can cost you your life. Let me tell you about James, a 73-year-old retired teacher. One morning while reading his newspaper, he suddenly felt numbness in his face and weakness in his left arm. Instead of brushing it off, he immediately called 911 and used the technique I'll show you next. That quick action saved his life and prevented permanent disability. The key warning signs you must never ignore. For strokes, watch for sudden confusion or trouble speaking, difficulty understanding what others are saying, numbness or weakness, especially on one side of your body, sudden severe headache, trouble seeing in one or both eyes, difficulty walking or loss of balance. For heart attacks, be alert for chest discomfort or pressure, shortness of breath, cold sweats, sudden dizziness, pain radiating to your arms, neck, or jaw. Here's the psychological challenge. Fear and denial cloud your judgment. It's natural to hope symptoms will pass, but that hope can be deadly. You need to train yourself to trust your body and respond decisively. Your action plan. Keep emergency numbers easily accessible. Consider wearing a medical alert device. Don't worry about causing a fuss. Your life is worth more than embarrassment. Call 911. At the first sign, not when symptoms get worse. Remember, the difference between calling for help immediately versus waiting can be measured in the quality and length of your remaining life. Strategy 2. Master self-help techniques when you're alone. When you're alone during a stroke or heart attack, isolation can feel overwhelming. But here's what you need to know. You are not powerless. There are practical, life-saving techniques you can use right away to protect your brain and heart while waiting for help. The most important technique is cough CPR, and it can keep you alive when your heart is struggling. Let me share Helen's story. This 78-year-old grandmother was home alone when she felt sudden chest pain and her heart started racing. She remembered learning about cough CPR at a health seminar and immediately started coughing forcefully every 2 seconds while dialing 911. Her steady action kept her conscious and stable until paramedics arrived. How cough CPR works. Coughing forces your heart to pump blood, preventing it from stopping completely. This is especially vital in those first crucial minutes when every heartbeat counts. The technique. Cough hard and deep every 2 seconds. Take a deep breath before each cough. Continue until help arrives or symptoms improve. Keep your phone within reach while doing this. Additional breathing techniques. Take deep, slow breaths to calm panic. Breathe in slowly through your nose. Hold for a few seconds. Exhale gently through pursed lips. Many seniors hesitate because they worry about doing something wrong. But here's the truth. The risk of doing nothing is far greater than the risk of trying these techniques. Helen's experience proves this. When panic could have taken over, she stayed calm and applied what she knew. She kept coughing steadily and managed to call for help. This kept her conscious and breathing until professional help arrived. Key takeaway: equip yourself with these self-help techniques and prepare mentally to use them confidently. You don't need to be a medical expert. Just be proactive and ready to take simple actions that protect your life. Strategy 3. Trust your body's early warning system. One of the biggest challenges seniors face is recognizing subtle early warning signs quickly and accurately. Many people ignore mild symptoms, chalking them up to age or chronic conditions. This delay can be fatal. Let me tell you about Carl, a 75-year-old who felt mild chest tightness and slight dizziness one quiet morning. Instead of dismissing it, Carl remembered the importance of listening to his body and decided to act quickly. He sat down, focused on steady breathing, and immediately called emergency services. Why early recognition? Saves lives. Stroke symptoms might be fleeting or mild initially. Heart attack symptoms can start subtly. Treatment is most effective when started quickly. Every minute of delay increases permanent damage. The challenge for seniors. Many seniors live with chronic conditions that can mask these warning signals. This is why education and awareness are absolutely vital. What made Carl different, his prior education through health workshops and regular doctor conversations, empowered him to take swift, decisive action when symptoms appeared. This awareness likely saved his life. The psychological factor. Understanding early symptoms helps reduce denial and fear, common responses that cause dangerous hesitation. When you can name what's happening, you can move from confusion to action. Your preparation. Strategy. Regular health checkups. Discuss your risk factors with your doctor. Keep a symptom journal. Share this knowledge with friends and family. Don't wait for symptoms to worsen. Call 911 immediately. Remember, seniors often worry about being a burden or overreacting. But when it comes to strokes or heart attacks, every minute counts. Your life is worth any temporary discomfort or worry about making a fuss. Strategy 4. Master life-saving positioning and breathing techniques. When a heart attack or stroke strikes and you're alone, how you position your body and control your breathing can dramatically influence your survival chances. It's not just about waiting for help. Your immediate actions can ease symptoms, improve oxygen flow, and reduce stress on your heart and brain. Here's Helen's story again, but focusing on a different aspect. When she suffered a mild stroke at home while alone, she felt sudden weakness on one side and was scared. But she remembered advice from a community health seminar. Helen sat down, leaned slightly forward, resting her elbows on her knees, and took slow, deliberate breaths. This simple adjustment helped her breathe easier, reduced dizziness, and allowed her to stay calm until paramedics arrived. Proper positioning during an emergency. For heart attacks, sit upright or slightly forward. Rest your elbows on your knees. This relieves pressure on your lungs and heart. Avoid lying flat. It might worsen. Breathing problems. For strokes, if you feel dizzy, sit or lie down to prevent falls. Avoid lying flat on your back unless absolutely necessary. Keep your head slightly elevated if possible. Critical breathing techniques. The 4-7-8 technique. Inhale slowly through your nose for 4 counts. Hold your breath for 7 counts. Exhale gently through pursed lips for 8 counts. Repeat until you feel calmer. Why this works: deep, slow breaths. Reduce panic. Controlled breathing lowers heart rate. Better oxygen intake supports your body during crisis. Reduces blood pressure and oxygen demand. The psychological benefit. Fear and panic are common during emergencies and can lead to poor decisions or physical exhaustion. By focusing on body positioning and controlled breathing, you restore a sense of control and calm, which improves your ability to think clearly and act decisively. Daily practice for emergency preparedness. Practice breathing exercises daily. Build muscle memory so it becomes second nature. Keep your phone within reach with emergency numbers. Pre-programmed combine proper positioning with prompt communication. Remember, these strategies aren't substitutes for medical care, but they're crucial first steps to support your body when immediate help isn't available. The right posture and breathing techniques buy you precious time, reduce complications, and increase your chances of survival. Strategy 5. The Golden Rule. Time is everything. When facing a heart attack or stroke alone, time isn't just important, it's everything. The difference between recognizing symptoms immediately and waiting to see if they pass can determine whether you live or die, whether you recover fully or face permanent disability. Let me share Robert's story. This 72-year-old man experienced unusual fatigue and mild chest discomfort one morning while home alone. Instead of brushing it off, Robert remembered the critical importance of early recognition and called emergency services immediately. Because he acted quickly, doctors administered treatment that minimized heart damage and saved his life. Why every minute matters. Clot-busting drugs are most effective. Within the first few hours, emergency surgery has better outcomes when performed quickly. Every minute of delay increases permanent heart or brain damage. The window for optimal treatment is often just 3-4 hours, the deadly mindset trap. Seniors often dismiss symptoms as normal aging or attribute them to less dangerous conditions like indigestion or fatigue. This mindset kills. Your emergency action plan. Before an emergency. Keep emergency phone numbers easily accessible. Know how to describe symptoms clearly to dispatchers. Alert neighbors or friends about your situation if possible. Have a clear plan to act when symptoms arise. During an emergency, call 911 immediately. Don't wait to see if symptoms improve. Describe your symptoms clearly and calmly. Follow dispatcher instructions exactly. Keep your door unlocked if possible for paramedics. Stay on the phone until help arrives. Overcoming psychological barriers. Fear and denial often delay action. You might feel embarrassed or reluctant to call for help. You might think symptoms will pass or that you don't want to trouble anyone. These feelings can put your health at great risk. The truth about asking for help. Asking for help is a strength, not a weakness. It's crucial for survival. Training yourself and your loved ones to recognize warning signs and respond immediately can make the difference between life and death. Robert's lesson. His experience is a clear reminder that knowing the signs and responding immediately can protect your health and extend your life. It's not about avoiding panic. It's about understanding what your body is telling you and acting swiftly. Now that we've covered these 5 life-saving strategies, it's clear how crucial preparation is, especially when facing a heart attack or stroke alone after 60. None of us wants to imagine being in such a vulnerable situation, but the reality is that it can happen to anyone. You might be thinking, I'm healthy, I don't need to worry about this. Or, I have family around, so I'll be fine. While that optimism is natural, life often throws unexpected challenges our way. Sometimes help isn't available when you need it most. The power is in your hands. Preparing yourself with knowledge and practical steps is the best way to protect your independence and your life. You have the power to survive, even in the toughest moments. What you've learned today: how to recognize warning signs and act without hesitation. Self-help techniques that can keep you alive when alone. The importance of trusting your body's early warning system. Life-saving positioning and breathing techniques. Why time is everything in emergency situations. Your next steps: practice these techniques regularly. Keep emergency numbers easily accessible. Share this knowledge with friends and family. Don't let fear or embarrassment delay life-saving action. Join our community. Please take a moment to share what you've learned. Leave a comment below telling us which strategy resonated most with you and how you plan to use this knowledge in your daily life. Your experiences and thoughts help build a supportive community where seniors empower each other. If this video helped you, please like, subscribe, and share it with others who might benefit. Your support motivates us to continue creating content that informs, uplifts, and inspires. Together, we can face these challenges with courage and confidence. Thank you for joining us today. Stay safe, stay informed, and remember, you have the power to protect your life, even in the most challenging moments. We look forward to seeing you in the next video.